Ask the patient to gently bite down on the cheek retractor to keep it in place. Inform the patient that during the process they may swallow any excess saliva they may have. Place the face-protecting gauze around the areas surrounding the cheek retractor and fold the top of the cloth under the top of the cheek retractor. Insert the cotton rolls into the cheek margin on top and bottom, left and right. Dry the gums and the surface of the teeth. Apply the rubber dam to the gingival area, creating a margin of 1 to 2 millimeters. Use the Beyond Curing Light in a moving, circular fashion to cure the rubber dam for about 3 seconds. Do not hold the curing light in place. Apply the lip protection balm to the inner lip and the areas of soft tissue which have not been covered by the rubber dam. Dry the surface of the teeth. Apply the teeth whitening gel evenly to the visible front teeth. For most patients, this will include 16 or more teeth. A 2 to 3 millimeter layer of whitening gel on the surface of the teeth is ideal. Adjust the angle of the whitening accelerator lamp head. It should be at a 90-degree angle to the teeth whitening gel. The whitening accelerator should be as close as possible to the cheek retractor. Press the start button to start the first 10-minute cycle. The dentist can tailor the treatment time based on the patient's discoloration and adjust the time of each cycle accordingly. Simply press the time button to make adjustments to the length of each whitening cycle. The recommended maximum length for any one cycle is 15 minutes. The dentist may provide the patient with music or video for entertainment during the treatment. Tell the patient to relax and enjoy the whitening procedure. After each cycle, the whitening accelerator will automatically turn off. Use the included suction tip to suction off the whitening gel on the teeth's surface. Do not rinse with water. Repeat the process twice, each time reapplying fresh whitening gel to the teeth. After the final cycle, suction off the whitening gel from the surface of the teeth. Remove the rubber dam and cotton rolls. Remove the cheek retractor and protective eyewear and ask the patient to rinse well. Assess the new tooth shade with the shade guide and record the results. Show the patient the change in their tooth color and take another picture. Use a cotton swab to apply the fluoride protection cream to the dried surface of the teeth. Allow it to remain on the teeth for 5 minutes. Then ask the patient to rinse again. After the procedure, give the patient the post-treatment guide and the Beyond Pearl White toothpaste. Make sure the patient understands the post-treatment guidelines. Within the 24 hours after the procedure, avoid foods such as red wine, cola, coffee, tea, soy sauce, hot sauce, and foods that are too hot or cold. Also avoid colored toothpastes and mouthwash. Avoid using tobacco products. Recommend patients to consume non-colored foods. Recommend the patient to maintain the whitening results by using Beyond eBright Tooth Whitening Accelerator Home Edition. The eBright system is a convenient way to touch up their whitening results at home as needed in the future. Patients may also be interested in purchasing additional Beyond Pearl White toothpaste for daily maintenance. For patients with severe stains, it may be necessary to perform an additional cycle using the liquid and powder mix type whitening paste included in the single patient Beyond Whitening 2 kit. Mix the two into a smooth, thick paste. Apply the whitening paste at a thickness of 2 to 3 millimeters to the surface of the teeth within the included brush. Employ the whitening accelerator for 5 to 8 minutes. Then suction off the whitening paste. Then follow the normal procedure using the Beyond Whitening Gel. We recommend Beyond Control Disinfectant to clean the head portion of the whitening accelerator after every treatment. The most important thing is to have good communication established with the patient prior to the treatment. The dentist must understand the patient's needs and let the patient know a reasonable expected result based on the patient's individual tooth situation. While most patients will not experience any tooth sensitivity after the treatment, patients with mid-level stains from tetracycline and fluoride may experience some mild, transient sensitivity after the treatment. The discomfort will not last for more than 24 hours. Tetracycline-stained and fluoride-stained teeth are a type of discoloration deep inside the teeth and often require more than one treatment for best results. Normally, dentists will recommend the patient to have the Beyond Whitening treatment prior to a porcelain crown restoration to allow the new crown to be matched to the new white shade of the surrounding teeth. It is recommended that patients with braces have the Beyond treatment after their teeth have been corrected. Power whitening techniques will not whiten porcelain crowns, veneers, or dental composite materials. Pregnant women and children under the age of 16 years are not recommended to undergo the Beyond Power whitening treatment. Please visit www.beyonddent.com for more information regarding the Beyond Power whitening system and to view Beyond's